Hello, good afternoon, everyone. Once again, this is Thankam Gomez from Cygnia Healthcare, and going to have a fantastic conversation with one of the veterans in healthcare in India, and it is none other than Dr. Narottam Puri. Dr. Narottam Puri, a warm welcome to this conversations, and thank
Thank
you
you very
so
much.
much. And
Thank
thank
you
you
very
so
much, Shankar.
much for taking time out and agreeing to spend some time with us. And I'm very sure this is going to be recorded and it will be available for long time to come. Thank you very much. And it's an honor for me to introduce Dr. Puri, who is advisor to Fortis Healthcare Limited, advisor to FICCI Healthcare Services, and advisor to Indian Medical Association, and he's also chairman of the Fortis Medical Council. And there are many, many more behind him. But I have known Dr. Puri since I have been in Fortis, and once I came to Delhi, I have come to know about Dr. Puri. And when I look at him, I see him as a person of integrity, person who speaks his heart, and person who is very relevant. And sir, I will never forget that one day we were having a chat on polity, and I was getting a bit frustrated because of the slow progress. And I said, sir, polity does not come free. Then I very clearly remember, Tankam, quality is like, you should be like a woodpecker. Keep on pecking, 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 and one day it is going to make a dent. And I always remember that advice, and I repeatedly use that as an example in all my leadership classes also. So, sir, I'm very, very honored that you are here, and thank you so much for being here. So, sir, should I ask the first question?
Please, please go ahead.
Sir, before that, before I ask the question, all the audience who is here, I would like you to tell me what are the different hats that you are wearing or you have worn throughout your years. Very quickly.
Well, I have been very fortunate. God has been very kind to me. I graduated in medicine from Delhi University, from Maulana Azad Medical College, in the year 1968.
Wow.
So it's about 52 years. So I've been very fortunate in seeing 5 decades of change in healthcare over this period of time. And I've drunk at many wells, so to say. I've worked in the state government, I've worked in the central government, I've been a teacher in the medical college, fortunately, in the same place that I was educated. Uh, I've worked as an entrepreneur, running my own polyclinic as well as a hospital, a 30-bedded hospital. And I've worked in not-for-profit hospitals, for-profit hospitals, and in both not-for-profit and for-profit hospitals, I've been fortunate to serve on the boards of many of these. So I've had a taste of the various facets of healthcare delivery, both in public and private. And since I've also trained abroad and have had an opportunity of going abroad a large number of times in connection with conferences, etc., it's broadened my horizon of looking at the healthcare delivery in the world. And during my days as chairman of NABH and even now my association with NABH, I'm deeply invested in quality and safety. That's something that I feel that is most important in healthcare, because from the perspective of the patient, what matters to him or her is really the quality of care. It is the clinical outcome. And that ultimately boils down to the quality of the care that the person gets.
Sir, I think you still forgot to mention a couple of other things. Apart from being a doctor, you
Ah,
are such a well-known cricket commentator. I think generations of youth they remember you, and and then there's another facet of you. So we would love to hear that also.
well, uh, yes, I was again very lucky in the fact that my hobby grew to such an extent that people of this country liked me. I started off playing cricket myself, but I realized that during my days in university, I would reach up to the university level. During my days, it was nothing else but 4 day and 5 day cricket. So it was not possible to marry cricket with medicine. And therefore, to get an opportunity to talk about it was the next best thing. And first, radio happened, and I started my career in radio in 1969. Soon after I became a doctor, I started commentating in 71 on radio, and then in 72 on television. And I was very lucky that my quiz show, which was called the Sports Quiz, became the longest running quiz show in the history. It ran for 18 years uninterrupted from 1974 to 1992. And I then had a second innings for a short period of time of 4 years or so. But my cardiac condition kind of derailed what would have been a second coming for a very long period of time.
Okay.
So I'm glad that I was able to be associated with the sport that I loved and that I was loved in return by my countrymen. As far as broadcasting and telecasting was concerned, I also wrote substantially on this sport for newspapers, magazines, and published a few books.
I know I have read about your, strength as a commentator in various forums. So, you being a healthcare personnel and being a ENT surgeon, so many hats you have worn. So, my hats off to you, sir, for managing so much. There is one more facet of yours. I will come back to that a little later. So my first question to you: what are the changes in healthcare you have seen over these years?
I think since it's a broad question, my outline will be also broad. In the sense, the first thing is that whilst it's true that we have not invested enough in healthcare in the country, just about 1% of our GDP, and that is beginning to show when epidemics like COVID happen in the lack of preparedness from the perspective of high quality care and availability of high tech equipment, particularly in the public hospitals. And that's the one thing that kind of hurts, that the country which was supposed to invest a lot in the public healthcare system. Because remember, Sir William Boreh Commission was formed during the British days in 1943, and it was ratified by the Indian government when we attained freedom. But it never really got implemented. And that was really the tiered structure from primary healthcare onwards till the district hospitals. And it never happened. The result was that as a corollary to the lack of availability of public health care, the people started investing their energies in private healthcare. So that void got filled, which is the natural corollary to occur. When there is demand, the supply automatically emerges. Initially, these so-called nursing homes were mom and pop shops started by leading physicians, gynecologists, pediatricians, and surgeons. But then came the big bang in the form of investors in social healthcare, and they were either the religious congregations, the churches, the temple trusts, the various kinds of religious institutions came into being in supporting the healthcare needs of the country. So that became the principal mode by which so-called private, because they used to charge a little sum just to meet costs and to invest earlier, that is how it started. Truly, healthcare remained by and large a cottage industry. And it was not until the organized sector came into being that the focus shifted to them. And to that extent, It is Apollo which started the corporate structure of healthcare in the 70s. And then other companies came along, both local as well as regional, and then national as well, so that now you have now a three-tiered structure of primary healthcare, public healthcare, uh, primary, I mean, sorry, public and private healthcare. And if you want, you can put the so-called not-for-profit structure as a separate entity.
Okay.
But then majority of the agencies consider them to be a part and parcel of private healthcare because they charge. Within the public sector, I think there was a huge expansion through the uh, kind of corporatization, because several public sectors started their own hospital systems. For example, BHEL did, BEL
Yes.
did, railways did, employee state insurance companies, ESI got formed. Rail, any big corporation needed a captive kind of a availability of healthcare within the premises or near its premises where its headquarters was. So if there was a mining town, then you needed something there. So that became another part or a limb of the public healthcare delivery system. But the rural part really remained neglected. And it is shocking that the national report that was published recently mentioned that two-thirds of the practitioners in rural areas today are unqualified. Now, that's a telling
Yes.
statement.
It's very
Now,
shocking.
that's as far as the structuring of healthcare is concerned, that the changes have occurred over the years. The thing that changed, I think, from the perspective of uh, medical and nursing education were also major. Earlier, there were only a limited number of medical and nursing colleges which were producing students, and then the privatization occurred and it suddenly blossomed out. The only thing is that if you look carefully, we focus too much on quantity and very little on the quality of the product. This is true not just in terms of what we are producing in terms of medical and nursing graduates. It's also true of the healthcare system, where you are obsessed with the number of beds, but you don't talk about what is the quality of that bed and the output that bed is able to provide to you. Uh, Healthcare traditionally has been rather lackadaisical as far as quality is concerned. Industrial quality uh, standards came very late into healthcare. Be that as it may, but the good thing that I think over the years that has happened during my lifetime is that I think this is evidenced by the fact that during the time of independence, just look at the life expectancy of an average Indian and look at it now. So something has been done right.
Yes.
Thing is that you have to remember that 70% of healthcare has been provided by the private sector. This is
Exactly.
the problematic area of this achievement, and that is because private health sector, by its very nature, will require to make money. It may not profiteer, but it has to make a profit. But if it makes a profit, then it takes the sheen off a little bit from the point of view of the government crowing a lot about the life expectancy part, or the reduction in maternal mortality, or the reduction in infant mortality, and also the eradication of many of the contagious diseases like smallpox. Malaria during my times had actually disappeared. And when I was a medical student, we rarely ever saw a case of malaria. And but then it came back in the 70s. Leprosy more or less is gone. Leishmaniasis, Kala Azar, smallpox, polio. So there have been a lot of hits that India has achieved over the years, for which the medical community needs to be proud of.
Thank you very much, sir. I think you have actually taken us from the beginning to current, and yet we entered on a very optimal note. All said and done, with the private sector pitching in India has made some improvement in the healthcare delivery. I mean, I think that's the way. Better to look at the glass as half full than half empty. Yeah. Thank you, sir. So let me go to my next question. You have been with healthcare and you have been an advisor to various organizations, healthcare delivery system. So if I may ask you that, what is the most critical talent for a leader in healthcare?
Well, first of all, I think I'm very relieved that I'm no longer the CEO or president of a company, but having run my own organization and having been in corporate healthcare for nearly 20 years now, I think the most important, there are several lessons. I mean, I know, Thankam, you take leadership lectures and you've attended many. Uh, I've also done the same, and you hear them and you get them on Google or anything. But to me, I think the uh, biggest trait that a successful leader needs to have are fundamentally the same as a good human needs to have. I think one is an honesty of purpose, a transparency is the second thing, and the third is communication. Now, communication is not necessarily just verbal, but communication of thoughts, communications of deeds, communication by non-verbal messaging are equally important. And I think if you are a good communicator, if you have honesty of purpose and you're transparent, I think the battle is three-fourth one. Uh, then there are, of course, other factors. Just as it has been said that to be a good doctor, you first need to be a good human being. I think it also translates into leaders. I mean, there are
I
two
think
types fundamentally: those who are forever, after you to produce results, etc., etc., and integrity and ethics be damned. And the others are, players of लंबी रेस का घोड़ा जिसको कहते हैं, the long distance runners who want to build organizations, who want to build people, who become mentors and who are respected even after they've shed their titles and the chair that they held. Those are the true leaders that I really admire. And I think you see these examples in many people whom I've worked with. You see these examples with the armed forces, and you see these examples uh, rarely in political life, but you do see them in the healthcare sector uh, quite a lot. And I'm glad because this is an area which uh, transforms the culture of not just the organization, because healthcare touches the lives of people, then this touches them. It bothers me a lot when you listen to a lot of lectures about ethics or non-ethical behavior of doctors, but nobody talks about the ethics and the non-ethical behavior of businesses which hire these doctors. So I think they're equally important. And when the two mesh together, you get the best results.
Oh, sir, that's a very, very deep thought that you have put forward. Honesty, integrity, transparency, and communication. I think you have kind of put them all together, and you can look at any other leadership skills required. They all will come and converge at these 3 points, I think. And that is so beautifully put, sir. And I know that I've heard you many, many times, and you are one person who live by that example. So I think for me, you are a leader who walk the talk. I have seen that. You actually walk the talk, and that's why I have got huge respect and regards for you, sir. And we always look up to you that, when you speak, we all listen. That's how it is. It's because you have lived what you have been preaching, and that is very, very important. And that's exactly how you summed it up, that the organizations, if have those values, and the business leaders, if they have those values, and the entire enterprise will follow and grow in that. And I think those kind of enterprises will outlast others also, I guess. That's how it is going to be. Thank you so much. That's a very beautiful answer, sir. So let me go to the next question. Uh, I know that you told me about the cricket, but I also know that you are a very good singer, and that you did not tell me. So now what I want you to be just be become little light and don't talk about healthcare and don't worry about what's happening in India and Corona. Just tell me about your other passions and how did you pursue that along with your medicine and other roles that you were doing in healthcare.
Well, it's a hobby. Like sports was a hobby. Uh, I enjoyed listening to music. I still do. And then certain questions started coming in one's mind as to why is a particular rag more effective when you hear it in the morning, or why is it sung in the morning, and why not in the evening. So these queries I answered, tried to answer by uh, asking someone to try and teach me the fundamentals of music. And I was more interested in semi classical and ghazal singing. So I slowly started learning a little bit about it. I used to sing like any one of us does, probably in school and college, but without really understanding the sur tal or any such thing. It was just the natural part of it. And then for several years, I became a disciple of the Delhi Gharana, and I started learning. Unfortunately, my Guruji developed a hepatoma, and although he was operated, he
Oh,
died. And then there was a void for some period of time, and then I again started relearning from same Gharana, a professor of music at Jamia, who became my teacher for 4 or 5 years. So I gave a few performances on the stage, but music is, for me, singing or any such thing is very personal, and I don't sing for any other reason other than the fact that it gives me some sort of a peace and some sort of joy. In I've stopped singing now altogether after my last angioplasty, but because I find it difficult to hold my breath. But uh, I think music is a wonderful thing. It's a great healer. It's a great even if you don't sing, do listen, and please listen to good music. Uh, Unfortunately, what has happened is today music is used uh, more to dance than to learn to listen, and so beat has become the dominant theme. But I think it's a passing phase. Melody is never going to fade.
thank you so much, sir. I did not know that you have actually been trained in music. I mean, that's really news for me. And you got time to get trained in music also. I mean, that actually tells your passion for music. That's really, really great to know. And yeah, as you said, sir, I think as we grow through our different stages, we tend to like different music. I mean, that's the way that I have been in different stages of my life. I like different music. I never had opportunity again to get trained, but I love to listen to music. And as you actually told that music is a healer, and it brings in a lot of peace to our mind if we listen to the right kind of music. That's really very nice, sir. Thank you so much for that. So let me come to our last question. It's actually second last. So this one is that how do you see the healthcare changing after this pandemic? We don't know when the pandemic is going to get over, but you have seen and you have been in the thick of things, discussing and deciding and recommending. So, what do you think the healthcare? How will we change?
Uh, See, when you have a pandemic of this proportion, which affects the entire world, the humanity is affected. To expect anything less than cataclysmic changes would be an idiocy. And therefore, I feel healthcare being an integral part of the management of COVID, this is going to change quite a lot. But there'll be, in my opinion, healthcare is only a small part, a microcosm of the entire universe of activities which are going to be affected by COVID. The first change that I sense will happen will be political, in the sense that hitherto, you know, when politicians would come to you for a vote, majority of the times over the last 70 odd years, there were five things which determined whether you get the vote, or at least you promised, other than the caste, creed, etc. Uh, One was roti, kapda, makan, bijli, pani. These five things. So if you promise the fundamentals, because that was what was the most crying need and still is to a large extent, health did not feature in this entire gamut of promises that were made. I don't think that's going to happen now. The amount of affection of people with this pandemic is going to make them demand, and the politician is going to respond to it. You're already seeing an example of it. You're already seeing suddenly a burgeoning of budgets, which have
Yes.
been, people are buying ICU beds. There, district hospitals which never had anything are nowadays getting better equipped, only because they sense that the public now wants it. So that's going to be the most important change, that healthcare will come on the horizon of what is an essential need. The second, I think, is going to be social and cultural. The behavior of how you meet, that is the masking, the social distancing, particularly the physical distancing, the way you cough, the way you spit. So there's going to be a social and a cultural change, because if you are going to do this, either the society will respond by themselves pointing out to you that don't do this, or they will shun you, or they will fine you. So social and cultural changes will be the next thing. From the perspective of healthcare per se, I think 6 to 7 changes will occur. One is there'll be a greater spend on public health, because you will now, A, politically need it, but secondly, now you know that you can't afford not to spend on having the basics. And fourthly, I think the structure of the hospitals might change, in the sense that you've had no consideration for infectious diseases, the separate places, the separate entrances, more open spaces being available. Everything is now, air conditioned, centrally air conditioned, in controlled environments. Now, probably you might need to have one or two negative pressure rooms. You will probably need a courtyard which is a little longer and wider, wherever one can afford it. So there will be design and structural changes in how hospitals are built. The other change I think that will happen is a huge fillip to teleconsults, to digital technology in the delivery of healthcare. Uh, Other change will be home healthcare will get a fillip. Research and development will get a fillip. We spend about 0.8%. Germany spends 3%. US spends 3% on R&D. So I think with vaccines, drugs, and pharmaceuticals, there will be greater research. So will be the case on the medical technology piece, that is the medical equipment piece. There will be greater R&D in that. And you're already seeing examples of this, from miniaturization of ultrasound machines to ventilators, which are now being manufactured in India. And also the medical textile industry, that is the PPEs, the masks, etc., is going to get a boost. The other important change, in my opinion, that will come will be in the medical education and nursing education sectors. This is very slow to reform, is not keeping up with the times, neither in numbers nor in technology terms. This will need to upgrade itself. Today, I think the cabinet is taking a view on allowing major private investors to come in from outside and set up universities, etc. Perhaps that may bring a change. But I see on the anvil a major change in the way we are teaching and we are our nurses and doctors, because they will need to factor in this new technology that is going to come in. Last but not the least, I think, is the impact that this is going to have on patient behavior and the doctor patient and the nurse patient relationship. Uh, whilst it is very convenient to, like you and I are talking, for the patient to be in teleconsults, I think uh, this takes away one of the other elements which is crucial to healthcare delivery, that sense of touch, that sense of uh, personal attention. And as you become more and more remote from the patient, I think that emotional link will get worse. And therefore, I see, not just because of this, but for multiple other reasons in the society, the degree of insularity and the degree of mental diseases, anxiety, fear, etc., remaining for a fair bit of time. So COVID has not only given us a kick our backside for many reasons to reform, but it remains to be seen whether the lessons are learned. Because change is inevitable, and we have shunned it. Uh, this is probably going to be that catalyst which might actually bring it about.
Thank you, sir. That's a very well summarized, points that you have from the political to healthcare to medical education to nursing to public to patients. You have actually touched all the ankles, of corona per se. And I think you rightly put that, change is inevitable and the changes are bound to happen and we better be ready with those changes. I think very well summarized, sir. Thank you so much for that. My last question would be, what will be your advice to frontline caregivers and especially nurses? Now that I have got you, so I have to get you to answer generally to all the caregivers in frontline. Right now, I know they all are going through undue stress, and it's very difficult time for them. Even if they are willing to work and care for the patient, it is not easy. It is tough. So what would you tell them? What would you tell them to just hang on? And how can they be still brave in front of all this, insecurities and uncertainties?
Uh,
I know it's a tough question, but sir, you have been there for so long. I'm sure that you can give some life's advice or lessons for all of them.
uh, yes, you're right. This is a very, very tough time. Uh, you did sign up to care, but you did not sign up to die. Uh, no medical profession, no nursing professional is going to be unaffected by what is going through, what is being gone through by just the public, by uh, the healthcare providers in general. And all I am including in healthcare providers, all those like the police people or people who are volunteers who are supplying stuff. Everyone I include because they are doing it for the health of the community. I think the best answer that I can give is something that Leo Tolstoy wrote. And he said, the two best allies that you have are time and patience. I think that's what you will need. With time, we will find an answer to this particular virus. We need not be disheartened. Never before in the history of mankind has the science, research, medical, nursing, administration, politicians, everyone together worked so fast that you are on the verge of developing a vaccine. Hopefully, it will be successful in a time frame which has been reduced to almost 1/10. That's a remarkable achievement by mankind, and you might have, if the vaccine is safe and successful, you might say that you won a major victory. It doesn't mean that COVID is gone. But the same thing will apply if we have the time and patience to wait for a drug which will kill the COVID virus. If we could find a drug for HIV, then why can't we find a drug for this particular virus? We will. I think it's only a question of time and patience. And times are tough now. I think mentally, physically, the medical world is exhausted. There have been a large number of fatalities in the healthcare sector, and the working conditions being what they are, with the PPEs in place, it is a very, very tough ask. I only hope that when the history of this COVID episodes are written, those who laid down their lives, cities and hospitals and wards, will be named after them. Why can't we name them after the war heroes? And these are nothing short of war heroes. Uh, I am not being overly optimistic when I say that there is light at the end of the tunnel. And I think within a year, we should have much better answers. So at this moment, all that we can do is buckle up and involve doctors, nurses, and all healthcare workers in propagating a very simple message that till such time that we find a cure or a preventive strategy that works, just follow the three basic principles. Proper masking helps you in 90% cases. If both parties are masked properly, 90% you're not going to get the virus infection. The second thing is social distancing. So if you're properly masked and you have at least 2 meters between the two of you when you're uh, communicating with one another, wherever it's possible, uh, then the chances are almost zero. And the third element of hand wash, and the fourth of non-congregation in large gathering. What you can't avoid at work, you can certainly reduce by the number of minutes of exposure that you are subjecting yourself to. So I think just these 5 or 6 general principles should suffice. You of course need luck, but then you need luck to go out on the road or to fly or to travel. But the fact of the matter is, I see that within a year we will have an answer. So stay put, believe in the God Almighty, and the medical science will find an answer to this.
Thank you so much, sir. I think, as you said, time and patience. That is essence, and just to be with each other and follow those 4 5 principles. I think COVID, when I look at it, I see that COVID has just brought back standard precautions and hand hygiene like a bang, and it's like telling that, we were telling you, you are not listening very seriously. Now you might as well. Suddenly the amount of training, and if you look at the COVID training, it is actually standard precautions, nothing more, nothing less. So entire focus have gone in there, and your mention about all our heroes who have laid down their lives. I hope whoever is going to watch this video in wherever they are hearing it loud and clear that you are suggesting that the wards can be named after them. That's a very fantastic suggestion, and I'm sure I will try to propagate this suggestion as much as possible to wherever I have the reach, and we will definitely do that. And sir, in the entire conversation with you is so enlightening and so blessing. It's like someone is, telling you that it's okay, we are going to be okay, and we are going to be okay soon. And that optimism is hugely important at this point of time, and we need to be with each other to be optimistic. And you being here tells everyone who is going to watch this video that just be there, just hang on, time and patience, and we will get it over there. And thank you so much, sir, for being on this show. And thank you very much. And I hope the recording comes well. A little bit of bandwidth issues I could see in between. So let's hope that it comes out really well. Thank you very much for your time. And please take care of yourself and convey your blessings to all the people who are going to watch this video. And God bless you, sir, and we look up to you and see you in some other time soon. Thank you so much. I feel a little sad that you said that I am not singing anymore. I was going to ask before we say bye, sir, at least दो लाइन तो गा दीजिएगा लेकिन आप कह रहे हैं कि मैंने तो बंद ही कर दिया.
Yeah, all I will say, Thankam, is thank you for having me on this communication platform to communicate my thoughts. Uh, the role of the individual, the role of the community is now going to be of paramount importance. Pandemics are not won in hospitals, they're won by communities and by individuals. And I'm reminded of uh, Shur Shayar. His sayings are very important, and that is, मैं अकेला ही चला था जानिब मंजिल मगर, मैं अकेला ही चला था जानिब मंजिल मगर, लोग साथ आते गए और कारवां बनता गया. Translated into English, it would just mean one thing: alone I walked towards my destination, but people kept on joining me, and soon it became a caravan. That's the attitude that we as doctors and nurses need to take, that let's do our own roles uh, fully well. And one of the major roles is to communicate to the public that you need to wear a mask. And you need to wear a mask for 6 reasons: for yourself, for your family, for your community, for your city, for your country, and for humanity. Do it and then see the results.
Thank you, sir. Your parting words are hugely useful to everyone. Yes, कारवां बनता गया और आपकी advice सर आंखों पर. Thank you very much, sir, and good day to you. Thank you, sir.